Hey guys, so let's answer the most commonly asked question at Natural Resident, and that is why do I need the customized residency list? Which this video is to give you a tour of our customized residency list portal. Um, Applicants ask why match a resident when I can use the official services information or program websites, or I can do it on my own. And the answer is you can't do it on your own because you have to communicate with programs first to get the most accurate information. And that's what Match a Resident does. We don't scrape websites, we don't get you information from websites or any official sources. We have our own information that's collected directly from residency programs, and that is for one single reason, and that is to collect context. Context on each criteria means we don't just ask what's a requirement, we ask if that requirement is required indeed or preferred, or if there's any exception to it, or if there's any hesitation, or there's most of our applicants have this score, right? And get interviews. Most doesn't mean all, and therefore we don't want to eliminate a program from a program that says they have a preference or have exceptions because they don't filter based on this criteria. So on the official services or websites, you may think it's required and you eliminate a good program when it's only a preference. So that means your entire application is going to be looked at, and therefore you don't want to eliminate a program based on that. Now, the way we do it is to filter. We calculate to sort. We calculate compatibility score. And you can see it with the list here, or each specialty. Each program have its own compatibility score, and this is the average of all the programs that you qualify for. And therefore, you can see here which programs may be better suited for you in other specialties if you were to consider a backup specialty. Okay. Now let's since most of you apply for family medicine, let's review the family medicine list. And as you can see here, we have the compatibility score. The compatibility score, the way we calculate this is that we look at your profile, your information, your step scores, your graduation, clinical experience, and all that information we collected from you initially in the profile, and we will compare it with the program requirements. And the program requirements since they're collected accurately, we give you a better list, better filters. Now, here you have 563 programs based on my profile, and you will have a different number here based on your profile. And then what we do is we sort it out for you. So if you have a budget, which most of us have, then that means you would apply to the top programs in the budget that you have. And therefore, we have created something called the top 100 programs, since most of you are looking for the top 100. Or you can go with meet my budget, and you can apply to the programs you qualify for. So that you can see here, 2450 would allow you 100 programs. So let's say if you can afford only 1500, you have 69 programs, and then we can calculate based on your budget. But if you select your top 100, now the top 100, the way we use the algorithm is to calculate your score and the program's score, which is the compatibility score, and give you an allocation, an accurate allocation for percentages. How many should go for safety? How many for target? How many for reach? That's extremely important. That's most of you are doing this now. How are you doing it? Match Resident have the data. So in order for you to do this, you need to collect data. You need to ask questions. Maybe you go to forums and see if any people have received interviews or matched these programs for you to make decisions, right? In this case, Match Resident doesn't make it hard for you. It's done automatically, and that is by creating an algorithm that will allocate your safety, target, and reach within good balance, depending on your score. As you can see here, you have some target programs, safety. You have some reach programs here. So as you can see, it's a good balance between reach, safety, and target, mostly target, which makes sense. More target go to applications. In our normal case scenario is 60%, 20% safety, 20% reach, and 60% target. Now, with Match Resident, if your score is lower, applicant score is lower, we allocate more toward the safety, and we take a good chunk of the target and a little bit from the reach, only if your budget allows. Otherwise, we don't touch reach because we want you to focus on target and safety only when applying with less budget, which gives you a higher chance, hopefully, for interviews and therefore a match. So as you can see here with Match Residence, you get a lot of information for each program. You see, let me just show you the details. Here you can see any ties we have with the programs in terms of interview link. Somebody like you who have interviewed, somebody like you who have matched in this case. You can save a program, you can apply to a program. We use this to calculate our program trends, and you can mark it for interview, and also you can add notes if you wish. Here's the requirements. The requirements that we collect have context to it, as I mentioned. So if we click on the next program to see to show you the preferences for some other programs, which is important. Now you see here we have required for interview. That's extra context, right? They require passing score, but they require passing score by the time you apply. That's extra context. This is yes, and it's 4 months of U.S. clinical experience, and it's required. This is not preference; it's required, right? So this extra information that we collect for you is what makes this list more accurate for you to filter, and the compatibility score is more accurate for you to sort, and that combination allows you a better list. Now here we collect more information that is supplemental, the connections that I mentioned earlier, interview link and match link, more information about the program. This is the program trends that I mentioned with the apply button that our applicants click. As you can see so far, 44% of the applicants pool in match on Match Horizon, which is a good sample to reflect the entire pool, is applying for this program. And you can see also here on interview feedback, which is the largest interview feedback available on the web for you to access. And here also you get more of the interview insights, which many applicants fill this survey after the interview from past seasons. And also we rate every aspect of the program, including the neighborhood, staff, coordinator, director, residents, program facility. And also one of the most important features that is not included, but we give you a 3-day free trial to try it, and this is a Program Insider. Program Insider has its own video I'm going to provide in the next session, and that is a tool that allows you to ask any question about the program in terms of signaling, program selection, pre-interview questions, what questions to ask during the interview, unique aspects of the programs you may need to write your letters of interest. So this is the Match Your Resident customized list. As you can see, it's very rich, and with the Program Insider, you cannot find more information anywhere else unless you go and ask search engines for information and have to dig through pages to find information that you need. And also, since our Program Insider is tied to our proprietary data, it's very unique, and also tapping into program websites to get you that information much easier. This way you don't have to leave the website. All right, so we'll stop here until the next video. Thank you.